बजाज आप सभी का बहुत बहुत स्वागत करती हूँ और आज के वीडियो में हमारे साथ चेन्नई से जुड़ रही हैं डॉक्टर राधिका मेका, जो कि एक आईवीएफ स्पेशलिस्ट हैं, कई सालों से प्रैक्टिस कर रही हैं और डायरेक्टर है परंपरा फर्टिलिटी एंड गायनेक सेंटर, जो कि चेन्नई तमिलनाडु में है। Dr. Radhika, we welcome you in our GMoney Health Show.
Hello, good afternoon.
And so Dr. Radhika, आज हम बात करने वाले हैं मेनोपॉज के बारे में, एक ऐसा फेज जो कि हर महिला अपनी लाइफ में अनुभव करती है, एक्सपीरियंस करती है। सो आप हमें ये बताइए कि मेनोपॉज के सिम्टम्स को कैसे मैनेज किया जाए।
Okay, before we go to the symptoms, हम मेनोपॉज क्या है वो समझना चाहिए। So menopause is when you stopped your periods. The periods have stopped completely. 12 months is usually taken as a time period. When you don't have a period for the 12 months, then it is said that you're in the menopausal stage. The symptoms, what symptoms? क्या symptoms हो सकती है menopause में? So the lady could have something called as night sweats, hot flushes. She might suddenly feel hot. So she will ask you to on the fan, open the windows, sudden heat in the body. Apart from that, a lot of mood swings. So she will start getting irritable, sleep disturbances, weight gain. All these are symptoms of menopause. Apart from that, the sexual function, the vaginal dryness, very uneasy feeling down below, and also urinary incontinence. So urge incontinence, that is, if she wants to go to use the restroom, she has to do it immediately. So what we call is urge incontinence. So these are some of the symptoms the lady might face during the menopause period, peri and the menopausal period. And the menopause age roughly would be something in Indian women from 47 to about 50-51. So it is not a fixed, it is a range from 47. But perimenopausal, that is, it could start 2 years before the actual menopause.
Okay, and ma'am, how do we manage these symptoms? कैसे इन symptoms को manage किया जाए? Because it becomes very, very difficult for the lady to manage these symptoms.
Yes, you have to come and see us. We would run some few tests. Hormonal tests are taken to confirm that you're in the menopausal state. Once it is menopause is confirmed, then we give you something called as hormonal treatments. Hormonal replacement therapy, because what happens during menopause is the estrogen and progesterone, the hormones which are normally secreted in the reproductive age, have come down drastically, and the ovaries, all that become very shrunken. So we can give something called as a hormonal replacement therapy.
So आपने अभी hormone therapy के बारे में बात की है. So I want to know what is MHT और ये कितनी useful साबित होती है?
Okay, hormonal replacement therapy, as I said before, it is hormones, estrogen and progesterone given in the form of tablets, in the form of gels, in the form of vaginal rings, vaginal creams, all that you have. So if you have vaginal dryness, then we have specifically vaginal creams which you can use for these symptoms. Hot flushes, we have oral estrogen tablets which you can use. But all these hormonal replacement must be taken with a gynecologist advice, because there are lots of side effects, lots of long-term complications with these hormonal replacement therapy. Okay. So it is not really advised for a long period. For a short period, a year or two is what is advised. So first come and see us, take our advice, and then start yourself.
Also, ma'am, you talked about estrogen. So which estrogen is best for menopause? मैंने सिस्टमिक एस्ट्रोजन के बारे में पढ़ा. अगर आप सभी महिलाओं को इस चीज के बारे में थोड़ा बताएं, थोड़ा एजुकेट करें.
So what we prefer is a low dose estrogen with a very small quantities, and it can be given oral tablets we can give. And if the lady has got a uterus, that means no hysterectomy, nothing has been done, uterus, we combine the estrogen with the progesterone also. So it's a combined hormonal treatment we give. Systemic is what we say oral tablets we can give. Low dose estrogen tablets can be given for a short duration of time to relieve all these menopausal symptoms. It works mainly very good for your hot flushes, the night sweats, the mood swings, the sleep disturbances, we could give for a shorter duration.
So जो भी आपको अगर कंसल्ट कर रही हैं जो अपने प्री मेनोपॉजल एज में हैं, क्या सबको हार्मोनल थेरेपीज की जरूरत पड़ती है?
No, it's not a rule that everybody will have these symptoms. Some do very well. It's a transition period. So the first 1 or 2 years they might have difficult. Some might not even really have these symptoms. So it's not that everybody requires them, but some really have bad menopausal symptoms. So those are the people we give them for a short duration.
And another thing, ma'am, एक उम्र के बाद osteoporosis भी महिलाओं को हो जाता है. सबसे पहले तो आप सबको ये बताइए कि what is osteoporosis और menopause और osteoporosis का क्या लेना देना है, क्या रिलेशन है?
Okay, osteoporosis is like आपका bones thin होने, so it's losing its density. The bones are thin and they're losing its density, so they are more prone for fractures, hip fracture or a femur fracture. All that is more common in the menopausal stage because of the hormones going down. So the bones are thinning out. So the hormone replacement therapy is very good for osteoporosis.
So menopausal age में osteoporosis का खतरा बढ़ जाता है, मैम?
Yes. Okay. Osteoporosis risk increases in a menopausal age group. But what you can do from your side is having a healthy diet, keeping your BMI well in normal limits, not getting your weight under control, lots of exercise, lots of sunlight. Vitamin D is very good. Vitamin D levels are very low nowadays. People are not going out in the sun. And balanced diet, all these factors, calcium supplements you can take. And if you don't HRT with the long-term complications, there are drugs specifically for osteoporosis. So we could advise you that also, which have less side effects compared to the menopausal hormonal replacement therapy. So the osteoporosis is due to the menopausal age. So we can do all this precautionary thing so that we could reduce the chances of thinning of the bones.
Okay, so osteoporosis and menopausal definitely are directly related. और अगर आप गायनेकोलॉजिस्ट से कंसल्ट करते हैं और ट्रीटमेंट फॉलो करते हैं, देन डेफिनेटली ऑस्टियोपोरोसिस की संभावना कम हो जाती है. सो डॉक्टर राधिका, मेरा अगला सवाल, जो मेरा आखिरी सवाल आपसे ये है कि मैं चाहती हूँ आप सभी महिलाओं को ये बताइए कि क्या मेनोपॉज के ड्यूरेशन में भी, क्या मेनोपॉज के टाइम भी कुछ टेस्ट्स की जरूरत पड़ती है? अगर हाँ, तो वो कौन-कौन से टेस्ट्स हैं?
Okay, ideally it is not required for us to do any test. If the lady doesn't get a period for 8 to 12 months, then we consider them as menopause. Okay, but in case they want us to run tests, we have some hormonal tests which we do. What we call as an FSH, estradiol, and the AMH test. We could run these tests. These tests confirm that she is in the menopausal stage.
And मैम, क्या इसके अलावा भी कुछ और टेस्ट की जरूरत पड़ती है?
Apart from this, we also do a lipid profile test, the diabetic status test, the thyroid test, and what you said, the hormonal test, which includes the AMH, the FSH, and the estradiol test. These are the tests run for a lady who wants to confirm whether she is in the menopause state.
तो डॉक्टर राधिका ने आज हमें मेनोपॉज के ट्रीटमेंट के बारे में बताया, कौन से टेस्ट की जरूरत पड़ती है, और ट्रीटमेंट आप जो भी करें अंडर गायनेकोलॉजिस्ट सुपरविजन ही करें, उनसे सलाह मशवरा करें कि आगे चलकर साइड इफेक्ट्स सकते हैं. एंड ऑन दैट नोट, डॉक्टर राधिका, हम आपको जी मनी की टीम की तरफ से थैंक यू कहना चाहते हैं. आपने अपने बिजी स्केड्यूल से कीमती वक्त निकाला और आप जी मनी हर शो में हमारे साथ जुड़ी. थैंक यू सो मच.
Thank you. My pleasure. Thank you.
तो ये थी डॉक्टर राधिका, जिन्होंने आज हमें बताया मेनोपॉज के ट्रीटमेंट के बारे में. मैं उम्मीद करती हूँ आपको आज का वीडियो पसंद आया होगा. अपना फीडबैक जरूर शेयर करिएगा और किसी और विषय पर चर्चा देखना चाहते हैं तो वो भी बताइएगा. ऑन दैट नोट, मैं नेहा बजाज आपसे लेती हूँ इजाजत. मिलेंगे जी मनी हेल्थ शो के एक नए वीडियो में विद न्यू सुपर स्पेशलिस्ट. टिल देन अपनी सेहत का ख्याल रखिए, स्वस्थ रहिए, मस्त रहिए, देखते रहिए जी मनी हेल्थ शो. अच्छी सेहत हमारा वादा.